Hi, good evening, everyone. I hope our audio and video is fine. So can you just quickly give the thumbs up to check whether the audio and video is fine? Okay, all right. So this session is specifically being planned for the students who are appearing for NEET PG 2022 exam, which is going to be on 21st of May. We were getting a lot of messages from the student that they are stressed, specifically after the new schedule that they prepared, that they were unable to identify that what to be done and what not to be done. So you can put your queries, you can put your doubts into the chat section, and we will try to answer all of them. First of all, I'm very happy to share the screen after a long time with Dr. Thameem. So welcome, sir.
Good evening, everybody. Hello, Rajat.
Yeah. So just for the student, today we will not be conducting Kahoot quiz. Today it's a session as the Kahoot is specifically planned for the students who are preparing for NEET PG 2022. So we thought that let us give some useful tips for the last days that are there. So today we are not conducting the Kahoot quiz. If you have any point that you want us to discuss about the NEET PG 2022 exam preparation, any stresses that you are feeling at this stage, we would be happy to answer on them. So I'm sure that you are utilizing the time effectively. I feel that the single most important thing that will help you in taking you close towards your dream rank is that if you're able to utilize the time that is there effectively. Specifically, when the exam gets delayed, our preparation gets derailed. And most of the time, we get this feeling in our mind, oh, now we have got more time and we will be able to do things in a better way. But actually what happens as a result of which, whatever schedule that you have prepared, that you want to do this thing by this particular time, gets derailed. So because a lot of students have messaged us for this, so we thought to do a session for you. Sir, what do you say?
Yeah, I think I agree with you. I think this is the time, the punch time that happens just before the exam. And we've seen this in the last 2 decades. That's the time when students sometimes either able to gather everything and reach up to that level, or suddenly they kind of throw in the towel and give up hope. So I think this session is aimed basically, I think in a very appropriate way. About 70 days are there for the INICT and about 80 days, I think, are there for the NEET exam. So I think one of the goals of this session is to help you, get your preparation on back on track if it's not so already. And I think just to give you an orientation about how you can plan your revision, I think most of you might be having a revision plan in your mind, but I think Dr. Rajat will highlight to you of how we've put subjects together. So we discussed before this session what subjects should go together. So he'll give you an overview of what subjects you can put together and revise them together, so that your revision should be able to get some integration. Although we don't recommend subject-wise integration in the first revision, but still, if you can segregate certain subjects which are similar together, it will help in your overall preparation even better. So I think with this, we can start off, Rajat. If you want to add a few words, then I'll give them my overview of how they should prepare.
Yeah. I mean, absolutely correct, sir. And I think I will just share the schedule with all of you. But before that, I want to say that most important thing at this stage is to follow a schedule, to decide that what you have to do in a particular day. I am very, very sure that a lot of you are already following a particular schedule. I also gave you a schedule from 15th of February. And if you are following that particular schedule, please, please do not change that. If you are following any other schedule, somebody else has given you, or you have framed your own schedule and you are able to handle that particular schedule, again, please do not change. Actually speaking, my experience of the schedules have been that who has given you the schedule does not matter. What matters is whether you are able to follow a particular schedule or not. If you think that your preparation is totally derailed and you are not able to follow any schedule, then try to use it. It will help you in bringing you on track so that you are able to finish all the subject once again. You will be able to recall your subjects once again, because the biggest challenge, as you could see, I am seeing um, in the comment box also, is that you are stuck at a particular score in the GT and you are not able to recall the stuff. So at this stage, considering we have around 70 days left with us, we will have to make sure that at least once I am able to revise all 19 subject very, very quickly with a specific focus on the notes and the previous year MCQs. So if you do not have any schedule in your mind and you think that you want a help, I think this schedule can be of some help to you. Sir, are you able to see the schedule?
Yes, I can see.
Okay. So if you're going to see, I am starting it from tomorrow. Once again, I am saying that anybody who already has a schedule, please do not change it. Please keep on doing that. Now, this schedule, me and sir has discussed it a lot and then we prepared it. So the idea of this particular schedule is the medical subjects or the subject related to medicine are kept together. Subject related to surgery are kept together. Like if you see anatomy, anesthesia, surgery, radio, ortho, ENT and ophthalmology, these are majorly surgical subjects. They are kept together. Physiology, pathology, pharmacology, pediatric, medicine, derma, psychiatry. These are basically medicine linked subject. They are kept together. And then microbiology, biochemistry, FM, PSM and OBG, they are kept together. So what we are trying to do is we are trying to suggest you that in the next 35 to 36 days, try to revise all 19 subjects once again. Now it's up to you that how many time or how much time you want to give to a particular subject. But if you're going to see, I have broadly given the days. Around 12 to 13 days, you will have to try to revise all these subjects and then you have to write a grand test. And then medicine subject should be revised at one go. Physiology, pathology, pharmacology, pediatric, medicine, derma and psychiatry. If you see, I have given equal time to physiology, pathology, pharmacology. If you want to read them in an integrated manner, that's totally your choice. But try to make a schedule and try to follow it. And after that, again, write a grand test. And then the rest of the subject like microbiology, biochemistry, 2 days each, FM 1 day, PSM 2 days and OBG 2 days. And by 6th of April, you should be able to finish one complete reading for the 19 subject. And then you can follow another reading. So before I go forward, do you have any suggestion on this?
I think what thing we've discussed and we have made is perfect. I feel we should stop at the first revision, and second revision we can have another session where we can discuss it, because I think they should have the freedom to make the second revision on their own. But I think the first revision, the way how you divided is perfect.
Yeah. Okay. So so please make sure that you are taking out some time to revise your notes. You are taking out some time to do the previous year MCQs. At this stage, I want to warn everybody that please do not try to read anything new is this time. A lot of time people come into fear of missing out, what we commonly called as FOMO, and they think that they have not done this particular topic, they have not done this particular topic. They should focus more about those topics that they have covered and they are unable to recall. Recalling of the content that you have covered till now will be far, far more important than reading a specific or a particular new topic. That is my experience over a period of time. Maybe I'll request sir to add some more to this.
I think the schedule you have made up is really very good, Rajat. I'm sure they'll benefit if they follow the general concept they have understood. I think they can make their own with some modifications to their taste. But I think the schedule that we have given gives them an overview of how they should plan it. Now, as far as the preparation is concerned, now I think if they plan carefully, they can easily do 2 revisions properly, and 2 revisions are very much required for these kind of exams. But if they can squeeze in another short revision just before they go for the exam, I think that will just be amazing. So 3 revisions can be done easily, I think, because around 80 days are there for NEET and about 70 days for INI-CT. So I think it's very much possible. Now, as far as the preparation, I think one point you addressed very correctly is that this is not the time for them to introduce new topics or something they have not read until now, because that boat has sailed. Means now what they should do is what they have read, they should hold all that together. One thing we have learned repeatedly in the exams is that we prepare very hi-fi stuff. Ultimately, in the exams, they ask easy questions. And we understood even last NEET that out of 200 questions, 100 questions were very easily doable. In the remaining 100 questions, about 20 questions were out of the thing, which nobody could answer, or they were very, very difficult. You could barely eliminate one option in those 20 questions and guess among the remaining three. But the remaining 80 questions were where the competition was. So 100 questions were very easy, 20 questions were very, very difficult. The 80 questions is where all the game is. And I think those 80 questions is what ultimately is going to decide what rank you get. Now, before we start going ahead, I think I'll just give you my overview of what you should do now. I think we already stressed this idea that you should not do anything new. You should just stick to your notes, and whatever notes you've made, remember that printed material is very difficult to revise. Whatever handwritten stuff is there is going to be the best solution for you to keep repeatedly revising. And this is not the time. I think some students have got this very wrong picture of, going on seeing more and more videos. And remember, in videos, active recall is not possible. Active recall is only possible if you're reading notes. So some people have this feeling that they are studying, they feel that they are studying just by watching videos. So that passive video watching that they're doing, they consider that also as studies. And actually that is not really part of study time. That is not the way how you prepare for these exams. Means you need to read and you have to do active recall. That's the only way. And without active recall, you're not going to benefit how much ever you read. So it's very important that you have sometimes, after each session, you have a 2-hour session. Then ideally it will be 50 minutes, 10 minutes active recall, again 15 minutes, 10 minutes active recall. You can divide it that way. So 2-hour session. Basically, the general principles I'll tell you first. The broad concept is when you're doing the first revision, your theory should be 80% of your time, 20% of the time should be questions. For example, if you're doing a 12-hour session each day, then you start with a 2-hour theory, then another 2-hour theory, 2 hours, 15 minutes break, 2 hours, 15 minutes break, and then 2-hour session is going to be MCQs. Then again, the evening session again will be similar. It should be 2-hour theory, and then 2-hour MCQs. So I think this is a broad principle of how you're going to read. Now you can modify when you want to do the 2-hour questions. You can do at a stretch 4-hour MCQs, or you can split it into like 2 hours in the morning and 2-hour MCQs in the evening. So totally your choice. Some of us moment we used to get up in the morning, would love to do questions. So that is also your choice. So basically, the general idea you should know, okay, 80% of your time in the first revision should be theory and 20% should be MCQs. That will change when you do the second revision. In the second revision, approximately 60 to 70% of your time will be theory, and about 30 to 40% of your time should be spent on MCQs. Now, when you're revising, again, broad principle I'm telling you, broad concept is कि in most exams, whether INI-CT or for NEET exam, generally the area that decide what rank you get are going to be the first year, second year subjects: anat, biochem, physio, patho, micropharmac, PSM, and OBG. So these are the subjects that you really have to focus more on. So in general, if you have some weakness in these subjects, it's okay to increase slightly more time in your revision, to particularly in the first revision, to focus on them. So this is the general idea. So 60% of your time should be on the first year, second year subjects, PSM, OBG, and then remaining 40% should be broadly on all the other subjects included. This is broad concept. Now, as far as the MCQs are concerned, if you are stuck at a particular score, if your grand test score is not improving, then one is find out which subjects you are losing marks in. That's the first approach. For all subjects that you're losing marks in should be highlighted, and you should focus on that. Secondly, whatever question that you're reading, the problem that you have in the test is sometimes the correct choice is explained in a lot of detail, but the choice you've chosen, you don't have much knowledge about it. That's why you got attracted to it. So one of the things about MCQs is mystery attracts. So whatever choice you're getting attracted to, if you know something about it, next time you'll be able to repulse it, you'll rule it out. So the point is whatever choice you're marking, you're getting attracted to, it means you don't know much about that. Read about those choices, not just about the correct answer, but about the choice that you have chosen. So in multiple choice questions, the more time you spend, the more you will come to know the tricks that are there. And some people keep reading only theory without doing questions. I think that's a big blunder. Doing only disproportionately high MCQs without doing theory is again a blunder. Although you should understand that those people are already in the top zone, who are already topping in most of the grand tests, they can afford to do more MCQs. But the rest of the crowd, I think they should strictly follow this idea about 80-20 ratio in the first revision and 60-40 or 70-30 ratio of theory to MCQ in the second revision. Now, as far as the grand test is concerned, once the grand test is over, you have to have an analysis of what subjects you're losing in, and you have to pay more attention to those subjects. Secondly, as I told you, that you cannot spend the entire day on grand test. You finish the grand test, then you should definitely find out what questions you have guessed the answers in and what questions you have got wrong. Those questions you should definitely spend more time on. And as I told you, again, don't read only about the correct answer. Make sure you read about the choice you got attracted to equally, because that is also very important. Now, again, broad idea is before you're going for the INICT, the last 10 days before INICT, focus more on first year, second year subjects, because that's important. Because after you finish the INICT, I think you'll have roughly about 10, 12 days before you go for NEET. Around that time, try to focus more on the clinical subjects. And you can revise the pre-para also, but pre-para you would have done before INICT. So you can put some weightage on clinical subjects later. So this general idea, if you keep these general concepts, I think you should be able to design a plan for yourself. Whatever plan you make, one thing is don't keep changing your plans. I've seen one idea is some people make a drop a plan, they're stuck it on their thing, and they are thinking about doing it, then they see somebody else's and then they change the plan. So like how somebody says, life is basically making plans. You keep on making plans until the day we die also, so but then you should understand that making plans without executing them is useless. So you should have a plan, and you should put all your energy behind that plan, and you should stick to it. So what's the fun of making a plan today, again changing it again you're revising another schedule, you're making another schedule, don't keep doing that. Stick to one plan and put all your energy in it. You'll get the results. Okay, so just have faith in yourself. Finally, our students, I can only tell, see, whatever concepts we've discussed in our classes, they will equip you with good thing to attend and do well in these exams. So don't worry about it. Have faith in the notes that we have given. Don't get over anxious at this point. I've seen sometimes also this very peculiar thing where some students study for 2-3 days, and then when I walk into the library, this person comes and tells me, sir, 3 days I've studied like crazy. If I keep studying like this for next 30-40 days, I'll be in that rank. Then what will I take? So basically, don't start dreaming just because you studied for 2 days. There are others who are studying for years. So just because you studied for 2 days, don't pat yourself up and say that don't start daydreaming about what you can do. At the same time, don't be in that negative mode. I've not done well. I've not done my UG well. And this is an unfortunate thing because none of us have done our UG well. So none of us have read the way how we should have read in our UG. And that's everybody. It's not only you. So keep these things in mind. Basically, don't get over anxious. Don't plan too many things. And remember, the difference between toppers and average students is toppers just do small things. That one extra MCQ, that one extra image, that one extra paragraph, that one extra thing you discuss with your friend, one extra thing that you revise when you are having your food, mentally you're thinking about it. Those small things, that's what that counts. So just start doing small things and you'll achieve great things in life. Rajat.
Yeah, I mean, sir, you have covered up virtually everything. But guys, all that I want to say is that please do not go into a negative framework at this stage. A lot of time you keep on setting up this vicious circle that you think that you are unable to read and you are not scoring pretty well, and you stop reading. And because you stop reading, again, you are unable to perform pretty well. And as sir has rightly mentioned, that you are just making the schedule but not following that. I mean, though there is no point on doing this. Please first stay in a positive framework, stay in a positive frame of mind that yes, you have time, you will be able to create a big difference in your preparation. One more positive point that I can say, that those who feel that they will not be able to improve at this stage, 70 days are there. Even if you improve by one question every day, there is still a chance that you can improve by more than 50 questions by now. In fact, more than that. But I'm just taking a you will say that a broad conservative figure. You can still improve by 50 questions, and that means that can still give you an improvement of 200 to 250 max, provided you don't think much about it, you read. More you're gonna read with a positive framework, more you will be able to perform in the exam. I know that there is a big challenge that a lot of us faces, is that we stuck with a particular score. If you stuck with a particular score, please try to identify that where are you going wrong. Sometime what happens is there are subjects in which you are very, very weak. You are forgetting that subject again and again. My suggestion for those subjects is, like somebody has written that you are weak in anatomy and ophthalmology. My suggestion to you is that first make sure that the previous year topics of those subjects are very, very thorough. I mean, if you think that you're weak in the anatomy, open up any previous year MCQ book and please cover the topics that have been asked very, very frequently. Because when I was preparing for my exam, I realized this, that if one of my subject is a weakness, it should not remain a weakness. It should come at par, and my strong subject will become my strength. Let my weak subject should not become my weakness, but my strong subject should become my strength. So this is the philosophy with which I believe. If I think that I have not done a subject pretty well at this stage, I do not have time to cover a video lecture. I cannot do at this stage. But what I can do is I can cover up the previous year topics of the last 4 to 5 years that was asked in the All India exam, or that was asked in the NEET exam or the NICT exam, and please be very, very thorough with it. Sir, there is a question that I repeatedly getting from the students on my WhatsApp, and that is that there are few students who were associated with us and they were preparing for NEET and INI-CT also. They are not really sure that how much their preparation is as per the INI-CT, but since there is not much of a gap between the two exams, so what is your suggestion that if a student wants to target INI-CT also, but their major focus is NEET exam, how they should change their preparation? What is extra that they should do for the INI-CT?
Rajat, I feel the difference for preparation wise between the two exams is not much, in the sense other than doing the last 3 year papers, there's nothing additional that you need to do for INI-CT. However, the general idea as we discussed is that INI-CT, your basics should be very strong. Your first year, second year subjects should be very strong. Your clinical subjects, they are not asking strictly, outright clinical. You can answer based on your micropharmac knowledge, pathomicropharmac knowledge. Also, you can answer medicine questions, for example. But they are asking questions in INI-CT connected with your internship experience. Like if you're putting a Foley's catheter, if there is blood spilt on the floor, how do you wipe it? What is the amount of pH? What's the pH of saline? Basically, those who are working in the hospital, those who are doing internship sincerely will get an advantage here. So those kind of questions are catered clinical questions. I mean, in the sense they are like say OBG question, but they're asking about steps of pap smear. So they are clinical subjects, but the kind of questions they're asking are basically going to benefit those who are working in the hospital. Now, as far as INI-CT, as I told you again, last 10 days before INI-CT tend to have more distributed time towards the first year, second year subjects, PSM and OBG, these subjects. Whereas before NEET exam, I think clinical subjects like medicine, surgery, OBG, PEDS, the final year subjects disproportionately should have slightly more time for them compared to the basic sciences. So if you keep this general concept in mind, I think you can be able to come up with a good plan of how to make your schedule and revise.
Yeah. Okay. And sir, there is a question that I am getting. What is the advice for the interns?
See, for internship, basically, obviously, in certain hospitals, certain colleges, it's very, very hectic. So what you can do is, see, ultimately, what we keep saying is, whatever you can do and what you will do, there should not be any gap in that. So you give your best, and if you can give your best, I think that's all that we can do. And obviously, during internship, sometimes it's very difficult. If you've already done your preparation, made your notes during your third year, your final year, definitely internship, you should be able to revise. So ultimately, revision is the key. So those who have their notes in the undergraduation period before they finish the final year, if they have their notes in hand, then their job is done. Internship, they just have to revise. Now, if the question is, I have not made notes, if you're not made notes in your internship, still you're in the internship year and you're not even made notes, then in that sense, I would say, basically make an attempt to go through all subjects. Don't leave any subject, but give more importance to first year, second year subjects, PSM, OBG, and less time. And if you have less time, then just do the LMRP, for example, or the LMRP notes, for example. Basically, you're allowed to afford a shortcut in the final year subjects, in the small subjects, but you cannot do that for a first year, second year subjects. So you need to understand that if you get a decent rank, to get a good rank, you should have importance to the first year, second year subjects, along with the PSM and OBG. I think these subjects, if you are careful in, you should be able to, during internship, also give a good attempt. Yeah. So there are some questions. I think Lakshmi asking one question: can we read long and small subjects together? See, the general idea Dr. Rajat showed the schedule to you is we put certain subjects together which are together in the sense medicine related subjects like medicine, derma, psychiatry, patho, pharmac, physio. These subjects go together. So if you can keep those together, and it's not necessary that you have to have a separate day for physio or separate day for patho. You can mix them together and read. However, that feeling of that satisfaction of having completed a subject generally comes when you go subject by subject. I've seen some people integrate. In the integration, sometimes they leave so much stuff. Ultimately, they are never satisfied that they have done the subject completely. So integration kind of technique should only be done for second revision. Ideally, it's not encourageable for first revision. First revision, better to finish subject by subject. At least you'll have the satisfaction that I've done these subjects, and those are finished. So second revision, when you do, you can mix up, you can do long or short subjects together, you can do integrated, you can do even topic wise, like you're reading thyroid, thyroid anatomy, thyroid surgery, thyroid physio, thyroid medicine, thyroid pharmac. You can do that integration, but that generally is not safe thing to do in the first revision.
Yeah. Rajendra, Bache, if you have not covered 2-3 subjects, please make sure that at least the previous year topics of these 2-3 subjects you have covered, that will be able to give you a decent amount of confidence in those subjects. If you already have notes of them, you can quickly revise the notes, but the previous year topics of these 2-3 subjects is must that you have to cover. Neeraj, there is a rule which I prepared, which is NOTA rule. You can go back to my YouTube channel and search for it. You can find out that if you are confused between two choices, how you can eliminate them. It can help you in some point. But if you have already completed a TND and you are looking for a schedule, the schedule that I have shared with you, you can use that particular schedule. However, if you think that you have already made one or another schedule for yourself, please follow that schedule.
So as far as medicine questions are concerned, long questions, one thing you should feel reassured is the longer the question, the bigger the question, means they're giving you more clues. So the more clues they'll give you, the more sure you are that you will be able to conclude as to what the answer is. So you should not feel afraid of or rather anxious about large questions. I think the bigger the question, the more beneficial. Where our fear is actually the factual one-line questions that come, those are the scary ones. So you don't get worried about the long questions, and you will in the long questions, basically look at the choices first and then start with something normal in the question. So if they're giving something normal, that will help you eliminate one option. So as you start eliminating options, you will be able to conclude as to what the answer is. So elimination is the correct technique when you are doing the long questions that are there in medicine.
So guys, just once again, I want to say that if you are preparing for the INI CT, there is nothing additional that you have to do, but just make sure that you are very, very versed with last 3-year NEET or INI CT paper. So last 3-year paper means last 6 paper. If you can go up to 10 paper, that means last 5 year, that is very, very good. But last 3-year paper, that means last 6 paper is must. That is the only additional thing that you need to add. Do not try to add more stuff. If you can add first aid in your preparation, that is obviously a very, very good boon in your preparation. Apart from that, I do not think that you need to add anything. If you are aiming for a rank in top 1000, I feel that there should be at least 2 to 3 revisions of the course that you have to do. Please remember, more number of revision you are able to do, the more are the chances you will be able to recall this stuff. But please do not try to do the revision just for the sake of completing the revision, that you are just doing it and you are not gaining anything. With every revision, your recall should improve. Like if one reading you are able to recall 40%, after second reading you should be able to recall 60%. After third reading you should be able to recall 70 to 75%. Fourth reading you should be able to recall 80-85%. Just do not keep on adding the number of revision that you have to complete these many revision. The revision should have a substance in it, and that is what you have to be aware. Please try to write few grand tests. As they say, do not run from a grand test. Do not think that if you will write a grand test, you will score bad and which will demotivate you. Even if you score bad, it should motivate you to perform better in the future exam. So grand test, sticking to your schedule, staying in a positive frame of mind is the only thing that is needed. I can tell you on behalf of the institute that if you have studied with us, we have taken care of you pretty well. The content that has been taught to you is enough to crack any entrance exam. So rather than looking it here and there, just focus on your notes, just focus on the content that has been taught to you, just try to revise them, just try to recall them, just try to recall as much as possible, so that if a question is asked from those topics, you are able to do that. I am very, very sure that all of you do very, very well in the exam. We have seen the results in last so many years, and we are expecting the same kind of result from our students as we have seen in the past, and I'm sure that you all will make us proud. So that is all from my side. So last few words from your side.
So finally, I think I can only say we've seen it now almost more than 2 decades. We've been discussing these kind of sessions. I think last 2 months, if people are able to, that's a beautiful bargain. It's 30-40 years of your career for last 2 months of proper efforts. And I've seen that no matter how well you've read last 2 months, if you are not able to get everything together, then all the effort that you put up till now is going to go a waste. So obviously you should not allow that to happen. It's very important that the next 2 months you plan carefully, you push yourself more. Ask yourself this question: is this the maximum that you're able to do? Because as I keep saying, that your peak should be last 2 months, and if you're able to peak in this time, and you should always ask this question: is this the maximum I can give? Because ultimately all of us are in a different situation. Some of us are doing internships, some of you, for example, are doing internships, some of you are really studying at home. So not everybody is equal, but the point is, whatever you can do and what you will do, that gap should not be there. So try to reduce that gap as much as possible. Don't try to do over ambitious planning. Don't try to do too much in our effort to do something too much. Actually what we do is we eat up in the other subjects. So make sure that you are distributing your time carefully. Whatever schedule you have made, you have to finish in that time. For example, if you get about 12 days for medicine related subjects, you should finish in those 12 days. Trying to do something extra is just going to cut into other parts of the subject. So obviously in the system, nothing is enough. Some people are asking me, sir, is LMRP enough? Is this enough? Nothing is really enough in the system. Basically what is enough is you should be able to really do the maximum that you can. And this is a competitive exam. If you can do more than what the others are doing, then you are in the groove, you are doing much better. So in that sense, it's really not enough for anything, and nothing really is enough. You just need to push yourself more, and whatever extra you can do, whatever more you can do, is always better. But as I said, that you cannot afford to leave any subject. Like I've seen some people tell me, sir, I'm going for the exam, but I've not read anatomy and biochemistry. Now that's a big blunder, especially if it's coming in the first year, second year subjects. You're not leaving. If you tell me, sir, I've not read medicine, I would say still it's okay. You can answer many medicine questions by your basic sciences knowledge. But if you're saying that you've left basic sciences subject and going for the exam, I think that's a big blunder. That kind of thing should never be done. So at least try to do just a broad idea, broad concepts of what diseases in the skin are, epidermal, what diseases are subepidermal, what are the conditions when Nikolsky sign is positive. So basic broad idea is what will stay with you. At least the broad things you should know. Means you can't go into too much detail, but at least the broad stuff. And one thing you'll realize, they are asking easy questions only. They are not asking very difficult questions. But the problem is it's too vast. It's 19 subjects. You should know about anal cancer staging. You should know about cervical cancer staging. You should know the management for this. You should know about a patient who's coming with diarrhea and how you manage. You should know about if a patient has got some HIV resistance, how do you treat that? So basically it's knowing everything together. That's what is going to be a problem. Knowing each subject in itself is fine. And this is what you would have felt also as you're doing the classes with us, that each subject you are confident you're able to handle. But then unless you revise it, and unless you are keeping everything together and integrating everything and knowing them before you go for the exam, then all that effort that you put is going to be a waste. So basically I keep saying this again and again. To live a dignified life, there are certain sacrifices that are required from us. And the question is, are we willing to give those sacrifices? So I think now is the time you should go to the next level. You should really boost yourself up, and you should push yourself more. And the broad ideas we have already shared with you, but nobody can make exactly what is required for you. Each of us is different. You have to make some modifications to whatever we have shared, the general ideas we have given you. So do look at this video once again, and you'll get a concept of what should be done. So general ideas about what is important, how you should plan, how much theory, how much MCQ, that idea we have shared over here for you. And obviously the rest of the job has to be done individually by you. But as I keep saying, push yourself more. Don't go to too much things. Stick to the next 55 minutes, 5 minutes or 10 minutes for recall. 2-hour sessions, 15 minutes break, 2-hour sessions, 15 minutes break. Make sure they're doing at least 20% of your time for MCQs in the first revision, and at least 30 to 40% of your time in your second revision. Last 10 days, very difficult to do frequent grant tests. So don't delay. Don't feel this key. Once I finish all my revision, then I'll do grant tests. Then only I'll do grant tests. That's a big blunder, because as you go close to the exam, that fear of wasting a day for doing grant tests will not allow you to do it. So try to do the grant tests much earlier in the first revision phase, as Dr. Rajat had planned it properly. So try to do grant tests in the initial phase itself. Don't keep it in the last few days. So keep all these things in mind. I think if you really push yourself more, if you are, as I keep saying, just do small things. Okay, the small things, one extra MCQ, one extra image, one extra thing, one little thing that you do, these little things. Sometimes all you'll have is just 20 minutes. And don't feel this 20 minutes anyway, today is over. Again, I'll start fresh from tomorrow. That like if you're doing internship, sometimes you finish your internship and you come home and you realize that you got only 2 hours. And if what will I do in 2 hours? I'll start from tomorrow. So don't allow that to happen. Those 2 hours also are precious. So as much as possible, do your best. And as I said, great things are waiting for many of you. We are all waiting to announce your name to the world and hold interviews with you. I think something great is written for most people. They just have to climb the steps and take it. Sometimes it's there in the fate, but if they refuse to accept it, if we ourselves say we cannot do it, then there's no one else who will believe in us. First, we should believe in ourselves. We should put the effort. So push yourself more. That's all I can say. And I think ask your questions. Ask this question to yourself every day. Is this the maximum you are giving? If the answer is no, then next day should be with more renewed energy, and it should be with even more effort than what was done previous day. Rajat?
Yeah, I mean, wonderful words, sir. I think I'll just stop by saying that I know it's difficult, but please don't give up. I'm sure that the life ahead will be beautiful. I know it's a stressful time for the next 2 months, but as sir said, that it's a good bargain. That it's choice, it's your choice. That just 2 months of some extra hard work can make your life comfortable for a much longer time. So we know it is stressful, we know it is difficult, but please don't give up. We are there for all of you, irrespective whether you were with us or whether you are not with us. Do let us know if we can help you out in any way. We will try our level best to provide you comfort, to provide you support so that you can reach to your dream rank. Okay. All right, guys, that's all for the day. Thank you very much for your time. And do let us know if we can help you out in any way, in any form. Take care and all
Thank
the
you.
best.
Thank you. Thank you.